Hello, my name is Ruben Palacios, and today we will be talking about prostate cancer metastasis. The definition: prostate cancer is marked by uncontrolled malignant growth of cells in the prostate gland. The prostate gland is the walnut-sized gland in man. It produces a store of fluid that helps to make semen, and it involves in related bladder control. Prostate cancer is the most common type of cancer found in men in USA, aside from skin cancer, and often begins without symptoms. Approximately 1 in 41 men will die from prostate cancer. Prostate cancer can be a serious disease, although most men diagnosed with prostate cancer do not die from the disease. In fact, in USA, more than 3.1 million men who have been diagnosed by prostate cancer at some point are still alive today. Prostate cancer can be slow growing such that many men die of the disease before the prostate cancer causes significant problems. However, many prostate cancers are more aggressive and can spread outside the confines of the prostate gland, which can be deadly. The prostate cancer survival rate is greatly improved with early detection and personalized treatment.
While it is true that prostate cancer is largely curable when diagnosed and treated early, patients with advanced prostate cancer have a less favorable prognosis. Advanced prostate cancer is defined as cancer that has spread beyond the original tumor. The most recent statistics estimate that 3 out of 10 men are still alive 5 years after being diagnosed with advanced prostate cancer. Male hormones, such as testosterone, cause prostate cancer to grow and survive. Early treatments for prostate cancer attempt to lower levels of testosterone in the body. This is known as hormone therapy. However, prostate cancer tumors may eventually begin to grow again, even though levels of testosterone in the body are low. At this point, the cancer is considered to be advanced. Researchers are studying why this occurs to gain a better understanding of how to develop treatments for prostate cancer. Talk to your doctor about questions you may have about advanced prostate cancer. Recent basic science and medical evidence suggest that one possible reason that tumors continue to grow is that they become extremely sensitive to the low levels of testosterone that surround them. In this way, tumors can grow even though there are extremely low levels of testosterone in the bloodstream. Additionally, studies done in both animals and humans show that the tumor may begin to produce its own supply of testosterone. This means the tumor is capable of fueling its own growth. In other words, in advanced prostate cancer, there is evidence to suggest that the tumor may be providing its own testosterone so that it can grow without depending on other sources of testosterone production. Talk to your doctor about new information regarding advanced prostate cancer.
Applications in medicine. Where can prostate cancer spread? In theory, prostate cancer cells can spread anywhere in the body. In practice, though, most cases of prostate cancer metastasis occur in the lymph nodes and in the bones. Prostate cancer metastasis occurs when cells break away from the tumor in the prostate. The cancer cells can travel through the lymphatic system or the bloodstream to other areas of the body. More commonly, prostate cancer metastases can occur in the bones, lymph node, lungs, liver, and the brain. Also, there are some rare locations like adrenal glands, breast, eyes, kidneys, muscles, and pancreas. See diagnosis. Most medical organizations encourage men in their 50s to discuss the pros and cons of prostate cancer screening with their doctors. The discussion should include a review of your risk factor and your preference about screening. There is more risk of cancer when the patient is a black person, have a family story of prostate cancer, or have other risk factors. Prostate screening tests might include digital rectal exam. There is one. The doctor insert a glove lubricate finger into your rectum to examine your prostate, which is adjacent to the rectum. If there is any abnormalities in the texture, shape, or site of the gland, you may need further tests. Prostate-specific antigen. This is a blood sample that analyzes the level of PSA, which in normal situation is found at low levels, but if there is a higher level than usual, it may indicate infection, inflammation, enlargement, or cancer. Diagnosing prostate cancer. If prostate cancer screening detects an abnormality, your doctor may recommend for a test to determine whether you have prostate cancer, such as ultrasound, magnetic resonance imaging, collecting a sample of prostate tissue to determine whether there are cancerous cells in the prostate.
Your healthcare team will use different tests to answer these questions. Keep watching to learn more about these tests and what information they give. You already know that the PSA test helps detect prostate cancer. But did you also know that it can show how well your treatment is working or if the cancer is growing? Your PSA level will be checked regularly during your treatment and as part of follow up care after treatment ends. This is called serial PSA testing. How often will your PSA be checked? That depends on the type of treatment you're having, how long ago you finished treatment, and how quickly your PSA level is rising. How do you know if your treatment is working? Falling PSA levels are a good sign. It usually means the cancer is slowing down or the cancer cells are dying. On the other hand, if PSA levels don't fall or start to rise, it may mean the treatment isn't working well, that the cancer is growing, or that it may have come back. Monitoring PSA levels over several months can help your doctor decide if you need other treatment. Depending on the treatment you're on, your doctor may use other types of blood tests to check your overall health, any side effects, and monitor how the cancer is responding. Your healthcare team may recommend more tests or treatment based on your test results and any symptoms you have. What other tests will your doctor use? The digital rectal exam, also called the DRE, and prostate biopsy are commonly used during diagnosis and may be used if you're monitoring the cancer with active surveillance rather than treating it right away. During a DRE, which you might know as the finger exam, the doctor inserts a finger into the rectum to feel for any irregular areas on the prostate that could be cancerous. During a prostate biopsy, a needle takes small samples of tissue from the prostate to look for cancer cells. While other tests can suggest there might be something wrong, a biopsy is the only way to know that it is prostate cancer. To answer questions like, is my treatment working? How large is the tumor? And where is it in the body? Your doctor may use different imaging tests. Hospitals have machines that let your doctor see inside your body and get a picture of things like your bones and organs. One of the first imaging tests your doctor may use will help guide the needle for the biopsy. It's called transrectal ultrasound, or TRUS. It uses sound waves from a small probe placed inside the rectum to create images of the prostate. Your doctor may use a CT scan to see if the cancer has spread to nearby lymph nodes or other tissues. These scans create a 3D image of your organs using X rays from different angles and can give more detailed information about the cancer. An MRI may be used to measure the tumor's size and scan your body to look for signs that the cancer has spread. MRI uses powerful magnets and radio waves to produce 3D images of organs, tissues, bones, and blood. Compared to CT scans, MRIs can produce clearer images of the prostate.
Pros and cons. There are several options for the treatment of prostate cancer, but the most important are surgery, that consists in the removal of the prostate and some surrounding lymph nodes during an operation. The type of surgery depends on the stage of the disease, the patient's overall health, and other factors. Chemotherapy, the use of drugs to destroy cancer cells, usually by keeping the cancer cell from growing, dividing, and making more cells, may help those with advanced or castration-resistant prostate cancer and those with newly diagnosed or castration-sensitive metastatic prostate cancer. A chemotherapy regimen or schedule usually consists of a specific number of cycles given over a set period of time. Radiation therapy is the use of high energy rays to destroy cancer cells, and a doctor who specializes in giving radiation therapy to treat cancer is called a radiation oncologist. Counts. There are some complications of this disease that consist in 1. Cancer that spreads metastasis. Prostate cancer can spread to nearby organs such as bladder or travel through bloodstream or lymphatic to your bones or other organs. Prostate cancer that spreads to the bones can cause pain and broken bones. Once prostate cancer has spread to other areas of the body, it may still respond to treatment and may be controlled, but it is unlikely to be cured. Incontinence. Both prostate cancer and its treatment can cause urinary incontinence. Treatment for incontinence depends on the type you have, how severe it is, and the likelihood it will improve over time. Treatment options may include medication, catheter, and surgery. Erectile dysfunction. It can result from prostate cancer or its treatment, including surgery, radiation, or hormone treatments. Medications, vacuum devices that assist in achieving erection and surgery are available to treat this disease.
Vital. So I've come to Cambridge University Hospital to speak with Dr. Vincent Nanaprakarsam to find out how they go about diagnosing this common cancer. Well, Vincent, prostate cancer is notoriously difficult to diagnose, isn't it?
Indeed, in fact, prostate cancer most often has no symptoms. A man might go to his GP because he has noticed a change in his urinary symptoms, getting up at night maybe, or having difficulty passing water. And most often that's due to a normal enlargement of the prostate as he gets older. In fact, prostate cancer doesn't cause any symptoms unless it's very advanced, in which case it might mimic some of those symptoms of an obstructive or large prostate. But if there are any concerns, the first step is to go and see your GP, who can then investigate.
So what would your GP do?
Most often what they'll do is take a history from you, do a examination of the prostate, and do a PSA blood test.
What is a PSA test?
So PSA stands for prostate-specific antigen. It's produced by the prostate gland, and it's a marker for the presence of prostate cancer. However, it can also be raised in other conditions, so it's not a very specific marker, but it's a first test that we can do to say whether we should proceed to further investigations.
So what happens if you get sent to the hospital for an examination?
The specialist will see you, again, take a history and an examination, and then most often what they will do is arrange a prostate biopsy. Increasingly, they might recommend a scan to be done first, an MRI scan, and then discuss with you what the best way to do a biopsy is.
And if it is cancer, tell us what happens then. Tell us about some of the tests.
Well, a discussion then starts. The first step is to make sure that we know exactly what kind of cancer it is, and that might involve other types of scans, for example, a CT scan or a bone scan. The kind of cancer is determined by the size of it or the stage of a cancer. And once the specialist puts all that information together with what the biopsy has shown, then they start to discuss with you what the treatments are.
Issue applying in Ecuador. In Ecuador, according to Solca statistics, prostate cancer occupies the first place in order of frequency of cancer in men, also generating the highest mortality rate, and its survival has improved thanks to the timely detection of the disease. There are some risk factors like age. The risk increases with age, especially after 16 years of age. Also, this does not include that it can occur in young men between 40 and 50 years old. Black rate. It is more frequent in black men than in white men, and in recent years, an increase of the disease has been observed in Asian men. Family history. Those who have had first-degree blood relative, increasing the risk to 2 to 3 times. Men carrying mutations in the BRCA1 and or BRCA2 genes.
Hi, I'm Dr. John Lynch. I'm a urologist and I specialize in treating patients with prostate cancer. Not only am I a doctor, I'm a prostate cancer survivor, so I know on a very personal level how difficult and scary it is to get the diagnosis of cancer. A cancer diagnosis is never easy to hear, and the emotional impact can be significant. What is important to remember is that, unlike many other cancers, most prostate cancer never becomes life-threatening. Now, if you've been diagnosed with localized prostate cancer, there are many treatment options available. Although prostate cancer is the most common cancer in men, it's also one of the most treatable, particularly when detected early. If your doctor has told you that you have localized prostate cancer, that means that the cancer has not moved outside of the prostate. You have a lot of very effective treatment options available. Deciding what treatment you should get can be complex. It depends on how much the cancer has spread, known as the stage of cancer, and how it looks under the microscope, known as the grade of cancer. It also depends on your age, health, and personal preferences. Some prostate cancers are very slow growing, and as I mentioned earlier, may never become life-threatening. In these cases, your urologist may recommend active surveillance or watchful waiting. Active surveillance uses regular PSA tests, rectal exams, and biopsies to watch cancer. If the cancer begins to grow, your doctor may suggest treatment, such as surgery or radiation. The goal of active surveillance is to allow you to keep your quality of life. This is often a good choice if your cancer is not expected to grow quickly. Active surveillance can give you years without any side effects that may come from treatment. Watchful waiting is sometimes used to describe the less intensive type of follow-up that may mean fewer tests and relying more on changes in your symptoms to decide if more aggressive treatment is needed. This option is more often used with elderly patients or those struggling with other health issues, as well as their prostate cancer. Two other common forms of treatment for localized prostate cancer are surgery and radiation therapy. Surgery, known as a radical prostatectomy, is removing the prostate and the surrounding organs known as seminal vesicles, nearby tissue, and some nearby pelvic lymph nodes. Radiation therapy uses high-energy rays to kill cancer cells. Radiation can be offered externally or internally. When internal, it's most often using implanted radioactive seeds. There are other treatment options available, but those that I've mentioned here tend to be the most commonly used.
Conclusion. Prostate cancer is one of the most lethal diseases affecting the male species. This disease is mostly asymptomatic and therefore very difficult to diagnose and treat, wreaking much havoc on sensitive populations, especially older men and people of certain ethnic backgrounds, such as African Americans and Hispanics. Prostate cancer has attracted much attention worldwide, prompting the creation of more awareness units that have devised models of preventive measures aiming at decreasing the level of the disease. The disparity between reported incidence and mortality rates leads to the likely conclusion that only a small proportion of diagnosed low-risk prostate cancer will progress to fatal disease during the patient's lifetime. Thank you.